Hey guys, welcome back to the channel. So today in this video, we are going to learn the classification of estrogen and related drugs in a super easy way. So no big words and no confusion, just simple tricks and the classification will be done. So without any further delay, let's get into the video. So, the estrogens and related drugs are further divided into five different classes. In that, the first one is estrogen, second one is anti-estrogen, third one is SERD, which means the selective estrogen receptor down regulators, and the next class is selective estrogen receptor modulators, which are also called as SERM, and the other one is aromatase inhibitors. So, to remember the names of all these five classifications, just remember one trick, which is SA whole square E, where S means it is SERD and SERM, and A means anti-estrogen and aromatase inhibitors, and E means it is estrogen. Now let's get into each class. So the first class, estrogen, is further divided into two different classes. So one is natural, other one is synthetic. Coming to the natural class, to remember the drugs under this, we have a trick. Either remember it as 1, di, and tri, or you can remember it as 1, 2, 3, or you can remember it as E1, E2, E3. Let me write the drugs now. E1 means it is estrone. E2 means it is estradiol. E3 means it is E3 means it is estriol. So either remember it as 1, di, tri, or remember it as E1, E2, E3. Then this class will be done. Now coming to the second class. The second class is synthetic class. So to remember the drugs under this, remember EMT. Just EMT. So where E means it is ethinyl estradiol. E means it is ethinyl estradiol. M means it is mestranol. And T means it is tibolone. Ethinyl estradiol, mestranol, tibolone comes under the synthetic class. The second class is anti-estrogen. Here there is only one single drug, and to remember this, just remember the term clomi, which means clomiphene citrate. It is an ovulation inducer. Coming back to the third class. So third class, it is called as SERD, which means selective estrogen receptor down regulator. Selective estrogen receptor down regulator. So here also we have only one single drug, and it is called as Fulvestrant. Then how do you remember this? So just remember it as full stop estrogen. Then you'll get the name Fulvestrant. Now coming back to the fourth class. So it is SERM, which means selective estrogen receptor modulator. Selective estrogen receptor modulator. Here we have three drugs. So to remember those drugs, we have the trick here. Either remember it as TTR, or you can remember it as TAM, TOR, Rally. TAM, TOR, Rally. Now let's see the names of it. Where TAM means it is Tamoxifen. TOR means it is Clomiphene. And Rally, R means it is Raloxifene. Tamoxifen, Raloxifene, Clomiphene comes under SERM class. So either remember it as TAM-TOR Rally or TTR. So coming back to the last class under this, the fifth one, we will be calling it as aromatase inhibitors. So there are three examples for it, and to remember their names, remember the term LX. LX. Aromatase inhibitors means LX. Aromatase inhibitors means LX. Now let us see the examples. Where A means it is Anastrozole and L means it is Letrozole. L means it is Letrozole. EX means it is Exemestane. Exemestane. Anastrozole, Letrozole, Exemestane. Exemestane comes under this aromatase inhibitors. So let me just repeat the entire classification once. So, estrogens and related drugs are first divided into 5 different classes. And to remember the 5 different classes, remember SA whole square E, where S means it is SERDs, SERM, A means it is anti-estrogen, aromatase inhibitors, and E means it is estrogen. Now, coming to the first class, it is called as estrogen. In the estrogen, it is further divided into 2 classes. So, one is natural and the other one is synthetic. And in the natural class, to remember its example, we have one trick. So, you can remember this as 1-di-tri, or you can remember it as 1, 2, 3, or you can remember it as E1, E2, E3. So, the examples are estrone, estradiol, estriol. So 1-di-tri, or you can remember it as E1, E2, E3. Now coming to the second class, which is synthetic. So in the synthetic, to remember the examples, EMT is the trick, where E means it is ethinyl estradiol, M means it is mestranol, T means it is tibolone. Coming to the second class, which is anti-estrogen. So only one simple example, which is clomiphene citrate. It is a ovulation inducer. Coming to the third one, which is SERDs, which is also called as selective estrogen receptor downregulator. There is one drug which is Fulvestrant, and to remember it, just remember full stop estrogen. And the fourth class is SERM, which is the selective estrogen receptor modulator. And to remember the examples under this, remember TTR or TAM TOR rally, where TAM means it is tamoxifen, TOR means it is torimifene, and rally means it is Raloxifene. Coming to the last class under this, which is aromatase inhibitors, and to remember the examples, remember one term which is LX, where A means it is Anastrozole, L means it is Letrozole, EX means it is Exemestane. So that's the classification of estrogens and related drugs. I hope this video made the topic easy for you. If this helped you even a little bit, please show it through your likes and don't forget to subscribe. See you all in the next video. Thanks for watching.